Hello, and welcome back to another episode of the Mermaid Vet Podcast. I'm your special guest host this week, Dr. Peter Mositis, and we're going to start a series of About You interviews with our staff here to help you get to know them a little bit better. And so first off this week, we have Sam. Say hi, Sam.
Hi.
Hi. And so the idea behind this is to get to know you a little bit better. So let's start off. Can you introduce yourself and tell us what your role is here at the clinic?
So my full name is Samantha, but everybody calls me Sam, super casual. I am a vet assistant here, but I am a surgical tech as well. So I'm currently going to school to get my license as a surgery technician and a vet tech. But I've been here for 3 years now.
So you're working as an assistant, but you're going to school for a vet tech. I know the difference there, but for our listeners, do you want to explain a little bit about what that means?
Okay. So in the state of Florida, you don't need a license to be a technician. But I personally want that license so that if I do go somewhere else or if I move out of state, I have that. And it's just education. And I really like to hone in on that and get better as I get older.
Yep. So basically, you're doing the same, a vet assistant and a vet technician in Florida, at least, do the same job. There's no title protection for vet technicians in Florida, which means that using the phrase technician it's kind of meaningless here, whereas in other states, you need to be licensed to call yourself a technician. We do try to reflect that at Mermaid Vet Hospital. We use the phrase vet assistant, which is an unlicensed support staff doing a technician's job. But basically, it's the same role, but a vet tech has more knowledge, more background, has gone to schooling, and maintains a license.
Yes.
Perfect. So what brought you into the field of veterinary medicine to begin with, and how long have you been doing this?
So I started back in 2016. I did some intern hours at another clinic that my actual dog was going to. He has passed since then. I learned a lot from the staff that worked there. I really love them. They were always very greeting and nice. And that's what I get here from Mermaid Vet Hospital as well. We're very compassionate. And I'm not to say anywhere else isn't, but here just feels like home to me.
Well, how did you end up at Mermaid?
I came back about 3 years ago. My husband was in the Navy. You guys had opened before I left, so I decided to go ahead and branch out, and I took a shot, and you guys hired me.
Cool. And the rest has been history ever since.
Yeah.
So what about Vero Beach? How long have you lived in Vero Beach, and what brought you to the area?
I've been here since I was 4 years old. My parents moved down from New York.
Wow. And what brought them here?
Better opportunity, just to change the scenery, and they had 4 kids, and they thought it was a better place to bring kids up.
Cool. What's your favorite thing about Vero Beach?
The beach. I love that it's right there. It's always hot here, so you can just go at any time. But like on a Wednesday, I can just get up and go. And it's like 10 minutes away.
That's true. You know, the availability of the beach and the weather here has always, if anything, it's stopped me from going as much because I grew up in the Midwest. And up there, you only have a couple months of summer. So when it's a nice day, you go to the beach. Like, you do not mess around. You know, in our case, it'd be a lake or a river, but you go and you feel a really intense need, like an urgency to going. Whereas in Vero, it's so nice all the time. I feel like I almost went less just because there was never an urgency that I have to go because it's always there tomorrow. And so, you know, now for me living in Orlando, I wish I went more often, even though it's 45 minutes from where I live to Coco, but still, I wish I took more advantage of it when I could.
I mean, you go to Disney and we go to the beach.
Yeah, there you go. And I am taking full advantage of the proximity to Disney right now with the kids.
Yeah.
All right. So if you couldn't live in Vero Beach, where would you live?
I live in Puerto Rico. That's my nationality. That's where I came from. My parents have a house there. I would definitely live there.
That's awesome. Do you get to go there very often?
I would say every 2 years. My dad, he's a frequent flyer, so he goes more often than we do. But if I could go more than that, I would love to.
Yeah. I mean, at least that's one upside to Florida is it's a lot closer than, you know, Seattle would be a lot tougher for sure.
Yeah.
So let's talk a little bit about your professional life. You work at the clinic, you're a vet assistant. What do you think is the most challenging part of being in vet med?
When it gets slow. I don't like to be idle, but I like to be busy all the time. I think that's my biggest challenge is keeping busy even when people aren't coming in all the time. And there's other clinical things that we can do, admin stuff, training, we can do that. But I really like interacting with the pets. I love interacting with their owners. So that's more of something that I like to do all the time.
So your least part of being a vet assistant is when you don't get to do vet assistant things?
Yeah,
It's like my problem is I just care too much.
it is.
What's the most rewarding part of the job for you? You mentioned, being with patients. Anything
Um,
specific?
if they come in sick, and we're able to see them in 2 weeks or whenever their recheck is, and they're like 1,000% better, and we don't see them for that issue ever again. Sometimes it's like a 50-50 chance that they come back and they're still not feeling very well.
Mhm.
But when we do surgeries and things like that, and we see them at their recheck and they're doing way, way better, those kind of things are rewarding for me.
Yeah. No, I could say that as well for myself especially when it's an uncertain outcome. And
Hmm.
I warn a client or a pet parent that there's a very good chance things might not break our way and that we've
Hmm.
done all we can. Having that time when they come back and their pet is better, they're feeling a lot better, and we got that unlikely positive outcome. I'm really always happy about that. And
Yeah.
even if I can't take credit for it, which is the case a lot of the time.
Hmm.
All right. Are there certain areas of vet medicine you're particularly passionate about? You mentioned surgery earlier.
I like surgery, but I love doing the actual dentals with the doctors. Dr. Hagstrom is our main dental doctor, and she loves doing them. I've learned a lot from her. It is something that is tedious for sure, but definitely trying to refresh my skills and things like that.
What's tedious about it? I know, but again, for our listeners.
Um, You never know what you're going to get because they could come in for their consultation and they look okay and they do need a cleaning. But then when you actually do the dental radiographs, you find fractures, you find, oral ulcers, things like that, that we wouldn't see to the naked
Mhm.
eye. But once we do our actual radiographs, then it's like, okay, we need to take this another step further.
I thought you were going to say because of those hard to reach areas,
That too.
right? That last piece of tartar that you're having a tough time reaching and maneuvering to get to.
I don't have that problem, but
And then I come along and point it out.
yeah.
So tell me about that, right? So that is something very different in veterinary medicine from human medicine. So what is your role in a dental anesthetic procedure?
To get under that gum line for sure, get the x-rays done, getting them to a healthy starting base so that the owners can start brushing at home because they don't eat sugar like we do. So the tartar just kind of builds up there. So they don't get cavities as much, but the tartar buildup is there. The oral health is like what 90% of what the issues are. Your heart, the blood, all of those things, they kind of go back to the mouth too if they're really, really bad.
Yeah, it's definitely important. I'd be hard pressed to put a percentage to it with a gun to
Hmm.
my head, but definitely important. I guess more to my point, you're doing the actual cleaning though, right? So if you were a human nurse, you wouldn't be doing dental hygienist work, but as a vet assistant, you're a bit of a jack of all trades. You do the dental x-rays, you do the dental polishing, the scaling,
Hmm.
you wear many hats, right?
Yes, we do. We don't do the actual extractions. That's where the doctor comes in. We just kind of let them know what we see. I like to kind of test myself and see if I was correct with a lot of things.
Hmm.
Um, but I do like to watch how the doctors take things out. It is a learning experience every single time.
Yeah, and I'll say on the tedious side of things for me, it's doing dental work, especially in small dogs, is a tight space. There's not a lot of room to view what you need to view. There's not a lot of room to maneuver, and you're dealing with very firmly attached, but at the same time delicate structures, right? So
Yeah.
you can't pull so hard you break something, but at the same time these things can be still firmly attached, and sometimes that bone can even start to
Hmm.
merge with the tooth when it's really hitting an advanced stage of the disease.
Yeah.
So definitely has its difficulty, and that's why Dr. Hagstrom is the most passionate about it.
Yeah.
I definitely do it, but it's maybe not my favorite thing in the world.
Yeah. We get a
All right.
surprise in there.
So now's a chance to tell your crazy story. What's the craziest thing that's happened to you as a vet assistant? What's like one wild story? I saw a picture of you the other day with a cat on your back. Does that rank?
Yes, because that's actually the first time any cat's ever climbed on me, and that's the
Hmm.
first time I let one. He's very, very well behaved. Once the exam was done, he was like, "Oh, I gotta go ahead, chill." So he did that to me. He does that to mom. He's very friendly. I always kind of keep my guard up with all animals, just because you never know. They could be fine 1 minute and then climb you the next.
Hmm.
But he was fine.
Yeah, we've had a surprisingly small number of
Hmm.
crazy cat escapees or climbing or getting into things at the clinic. And as much as I'd love to give credit to our handling for that, I think part of that really is just luck, because I've seen some really good assistants at other clinics have some wild cat stories. Cats escaping into the ceiling, cats
Yeah.
escaping into the plumbing, cats escaping into the walls, cats escaping into your clothes. So,
Yeah.
all right. So you're at Mermaid Vet Hospital now. What do you think sets Mermaid apart from other clinics? Why do you think clients should come here?
I would say for if I was a client and looking from the outside in, we do go over everything gold standard. We give you every option in the book as far as what we're able to do here. And if we couldn't do it here, we will, refer you somewhere else. But we make sure that you're comfortable with the decision that you make. If you can't do XYZ, we say, okay, let's go this route. And then we can, reassess in a week or two to see if we are doing better. We always make sure that you are comfortable with every step of the process. We never want to blindside anybody, especially myself. I would feel the same way, that I want every option available to me. And if I can't do it, that's my decision to make.
Yep. So that ties back to Tim and I have been talking a lot about a spectrum of care the last
Hmm.
couple of weeks on the podcast, and giving those options and doing what we can, even in not ideal situations or situations where finances are tight. It's a very
Hmm.
common thing we encounter.
Yeah.
All right. So what about your personal life? Do you have any hobbies? What do you do outside the clinic?
Try to sleep as much as I can, but no hobbies as of yet. I'm just in school right now and taking care of that. I have 2 kids, so
Mhm.
any chance I get to be with them, I'm all for that. And I'm really big on just family functions. So anytime my brother and my sister are in town, we go ahead and go over there and just have fun.
Awesome. Do you have any pets at home?
I do not. I lied. I have a fish, but that's it. We are in the future, maybe in the next year or so, getting a dog, a pug to be specific, but not
What?
right. Yeah.
Do not get a pug. Do not get a short nosed breed.
I know the
I don't want to
risks.
fix them. All right. If you could, if you weren't in vet med, what would you do you think?
That's a hard question. I can't really imagine myself outside of what I'm doing right now. It took me a long time to get to where I am. If I hit the lotto, then I'd probably just be a lazy bum on the beach. But as of right now, I
Hmm.
couldn't see myself being anywhere else.
Yeah, cool. And all right, if you could wave a magic wand and you would instantly educate all pet owners on one topic, just one topic, what would it be and why?
In Florida, definitely be heartworm prevention. If I
Mm,
could do that, it'd be great because I'm gonna say it. We hear it all the time. People say they live in a gated community, and bugs are bugs. They're gonna get inside, whether you're rich, poor, it doesn't matter.
mhm,
So it's how it's contracted. It's the infected mosquito bites a dog that doesn't have it, basically gives it to them after they, of course, suck the blood from a infected dog, and it just goes on and on that way. So having the prevention is exactly what it is to prevent that getting worse. Um, so that's pretty
oh,
much
wow.
the main thing.
You're not just wishing, you're waving that magic wand.
Yeah. Ding, ding, ding.
I'm told this podcast reaches at least 5 people, including myself. So, you know, that's 4 fewer we need to worry about. You heard
I
it here
know.
first. All right. Anything else you'd like to share about your experience as a vet assistant? We'll dive
Uh,
into some rapid fire questions.
you're gonna ask me a question?
Yeah, they're
Um,
tough ones.
okay. Nothing really. I mean, I really enjoy my job. I just want to get better at it. If I could be what you wanted, I'd do it like that, but it takes time, you know. But every day's a learning experience, and I like that.
All right, cool. We'll jump into some rapid fire here. These are from Tim. Humans or animals?
Animals,
Cats or dogs?
dogs,
Chihuahua or Great Dane?
a great day.
Anal gland expression or nail trim?
The anal glands.
Really?
Yeah.
Wow, crazy. All
Hmm.
right. Any parting thoughts you have for our viewers, our listeners?
I would just say that, if you guys ever have any questions about anything, always call your veterinarian. Ask them. They can only recommend the best that they can, and bring them in when you can. Keep them up on their vaccinations and their preventions, and keep your the love of your lives. Your pets are your family, and if they are that, then just keep them up to date on their health, because they age faster than us. Things happen faster, so keeping them up to date is the best thing to do.
Absolutely. All right. Well, thank you guys so much for spending time with us in this special get to know you shorter episode of the Mermaid Vet Podcast. And as always, if you want to learn more about us or learn more about Sam, our technician here, make sure you visit us at themermaidvet.com, follow us on social medias, and make sure to like and subscribe. Thanks, and we'll talk to you soon.
Thank you.